takes hard work to make it to the top, and for Howard Beggs, the work started early.
My first job, as I recall, was a newspaper around at age 11, and I don't think I've managed a year off since then.
Howard grew up in Dublin, and after his early experience on the paper round, he went straight from school into work, starting out selling computers and then moving through various businesses before starting up his own company, producing IT solutions for the healthcare industry.
Like a lot of things in life, you end up in a particular sector a little bit by accident, but I've worked in the healthcare sector now for 16 years, and I nearly look back and say I know little else at this stage. Our business is healthcare IT. Our technology touches probably 80% of medical professionals at the primary care sector in Ireland. Approximately 8 out of 10 general practitioners in the country would use one of our software applications to do their prescribing and their patient records.
A salesman at heart, Howard has fitted out their Dublin headquarters with a display to highlight the full potential of the Helix health model.
The reason we created this area was to demonstrate that Helix health software is used right across the healthcare spectrum, from the home through the GP area and right into the pharmacy and the dispensing of drugs. Some of the technology we're working with allows patients to be reminded to take their medication in the middle of watching their television programs, and also to make appointments with the GP. Let's go to the GP. On arrival in the GP practice, our technology that we're developing at the moment, which is also available in Gaelic, allows the patient to do self-check-in, because what that does is it interfaces with what the receptionist would see or the administrator would see, telling them that the patient has now arrived, and that then calls the patient record up automatically for the doctor, so the doctor can see the patient, have the consultation and produce the prescription. The next thing that happens then, the patient brings that prescription to the pharmacy. In processing the prescription, just to give you an example, so we'll go and select the stock and will automatically dispense the product for you. It means the medication can actually arrive as the pharmacist is consulting with the patient. In Ireland so far there is, and we've been doing this now for about a year and a half, there's almost 20 robotic systems across the country. I would love every pharmacy in the country to have one of these. And I think as the squeeze comes on the pharmacy profession, you know, to drive efficiencies, we're seeing an awful lot more interest in this type of technology.
With a dominant position in the Irish marketplace, what's the next step for Howard and for Helix Health?
We have an aggressive business plan. We see considerable growth coming, but mostly from internationalisation. We have a very good base at this stage right across the UK, and this year sees us move into the Middle Eastern markets.
Howard's big break came when he decided to go back to college and to study for an MBA.
Was leaving cert straight into work, ploughed away for a few years, and then I recognised in myself, I would have been in my mid-20s, you know, to move on, I'm going to need to raise the game a bit, and this was seen as a key part of that. The closing weeks in that MBA programme were a big turning point for me as an entrepreneur. Up to the point that I graduated that MBA, I ran a small business like anybody else would do in the early stages. What this did was it acted as a catalyst to open up opportunities. At the time of graduation, we employed 9 people. Now it's 93, 94 people. So it's quite a difference, and I would expect that level of growth over the next decade as well. So certainly I'm set on that course.